My name is Stambough, and I am one of 2 fellowship-trained pediatric and adolescent gynecologists here in Arkansas. My partner and I, Dr. Hollenbach, are fortunate to be able to care for girls aged 0 to 22, and we take care of all sorts of different gynecologic conditions that they may face. In terms of what are the common signs for teenagers that are suffering from anxiety, I really kind of categorize those in 2 different groups. And what I usually think about is the emotional side and then the physical side of how anxiety may be seen for patients. So from an emotional side, teenagers may describe feeling restless, have issues with sleep, feeling a little panicky, or kind of feeling out of control. In terms of the physical side, sometimes our patients come in with non-specific complaints, meaning headaches or abdominal pain, chest pain, feeling like their heart is racing. And when we look for a physical reason for that, we can't find one. And then that gets us thinking a little bit more whether those are symptoms of anxiety for that patient. When we try to look at whether girls are more prone to anxiety than boys, they've done a number of studies that have shown that the prevalence or the amount of girls who have anxiety disorders compared to boys is increased. So we do think that more girls have anxiety disorders than boys. So certainly puberty is a time where anxiety disorders or anxiety symptoms may become more pronounced for patients, and certainly puberty can be a provoking cause of anxiety for a lot of patients. But what I tell parents is that kind of normal day-to-day irritability or feeling a little anxious that doesn't interfere with your child's ability to enjoy the things they love, interact with their friends, go to school, can be somewhat normal, but certainly when these symptoms start to affect their day-to-day, how they interact with other people, if they withdraw from the things that they love, or become almost a different kid for you, then that's certainly a concern for an underlying anxiety disorder, and one in which I think needs further evaluation. This is a really, really important question and a really important thing for parents. And I think the first thing to do is to make sure that when you approach your daughter about concerns for anxiety, you do so in a way that is allowing them to be open and to have dialogue about what's going on with them, and also in a way that allows them to express how they're feeling, kind of without fear of judgment. And so I think coming from a place that expresses your concern for your daughter, hey, I've noticed that you've been doing X, Y, or Z. These are some concerns I have. How do you think you're doing? And allowing them to kind of be open and honest about where they are is the most important thing when approaching them. I think the other thing that's important is having a plan for when your daughter may express to you that she has anxiety, and that's where medical professionals come in to help you. If a parent would like to schedule their child to see us in the pediatric and adolescent gynecology clinic, we would be so happy to see them. You do not need a referral to see us in clinic, so you can call to make an appointment yourself, or if you'd like, your physician can refer you and we'd be happy to get you in just as soon as we can.